I'm David Van Slyke. I'm the Dean of the Maxwell School of Citizenship and Public Affairs, and it's my great pleasure to welcome you to the 30th Annual Herbert Lourie Memorial Lecture on Health Policy. First, I'd like to acknowledge with respect the Onondaga Nation, the indigenous people upon whose ancestral lands we now gather. As many of you know, the Lourie Lecture honors Dr. Herbert Lourie, who was a distinguished physician and a member of the national and international medical communities in the field of neurosurgery. Dr. Lourie was a physician who understood medicine as a high calling that demands the utmost of skill, intellect, compassion, and character. This lecture series is a wonderful opportunity to bring our community together, to hear from thoughtful and accomplished professionals involved in the issues that animated Dr. Lourie's life. I'd like to thank the Central New York Community Foundation for their generous support that makes this lecture series possible, and of course, the Lourie family. I thank the Center for Policy Research for hosting the annual Lourie Lecture. CPR is home to nationally and internationally recognized scholars who conduct a broad range of research on interdisciplinary questions and activities related to public policy. Professor Len Lopo directs the center along with his team, including Peggy Austin, Katrina Wingle, and Emily Minot. Located within CPR is the Lerner Center for Public Health Promotion. Named in honor of a generous gift to the university from Sid Lerner and his wife Helene, the Lerner Center works to improve population health through applied research and evaluation, education, engaged service, and advocating for evidence-based policy and practice change. The Lerner Center works in partnership with citizens, students, researchers, and public health professionals to identify needs and to develop and implement a wide range of programming and collaborative initiatives. I'd now like to introduce Dr. Shannon Manat, the Maxwell Lerner Chair for Public Health Promotion in the Center for Policy Research. Dr. Manat is an associate professor of sociology, and she has received her PhD in sociology from the State University of New York at Albany. Prior to her appointment, she held appointments at the University of Nevada, Las Vegas, as well as at Penn State University. As a scholar of social inequality and social demography, Dr. Manat examines the relationships and consequences of social disadvantage, particularly at the intersections of place, public policy, and health. A common theme binding much of her work is a concern for rural people and places. Her current research focuses on the social determinants of opioid use, disorders, and mortality, particularly in rural and small-town America. Shannon? Yes.
Thank you, Dave, and thank you to all of you for being here. I'd like to repeat David's thanks for the Center for Policy Research, particularly Emily and Peggy, who really helped to coordinate this event and all the travel arrangements for Carol to be here. So when trying to decide on a speaker for this year's lecture, Dr. Carol Graham seemed like an obvious choice for someone who could help us to understand many of the most pressing health concerns facing the U.S. today, including declining life expectancy and record high rates of the so-called deaths of despair, drugs, alcohol, and suicide. Currently, U.S. income inequality is at an historic high. The prime age male labor force participation rate has plummeted. Real wages have been stagnant for most workers for more than 3 decades. Fewer jobs come with benefits like health insurance, paid leave, and pensions. And young adults today have a much smaller chance of moving up the income ladder than in the past. A large share of this country is truly struggling, and the chickens have come home to roost in the forms of increased stress, poor mental health, and reduced optimism. So who better to talk about these issues than Dr. Carol Graham, an expert on happiness, hopefulness, and optimism. Carol Graham is a Leo Pasvolsky Senior Fellow and Senior Director for Global Economy and Development at the Brookings Institution. She is also a College Park professor at the School of Public Policy at the University of Maryland and a senior scientist at the Gallup organization. Dr. Graham received her bachelor's degree from Princeton University, her master's degree in international economics and Latin American studies from Johns Hopkins University, and her PhD with concentrations in economic development, political economy, and Latin America from Oxford University. Dr. Graham was one of the first economists to work on happiness and has done extensive work around the world on the consistent patterns and the determinants of happiness across different countries and across time. She's also been a leader in exploring the causal properties of well-being and showing that happier people do better in the labor market and in health arenas, a pattern she identified as early as 2004. Most recently, Dr. Graham has established linkages between lack of hope and premature mortality at the individual and place levels in the United States. She's the author of over 50 articles and 7 books, articles in academic journals including World Development, Health Economics, Journal of Population Economics, and International Journal of Wellbeing. She's written numerous op-eds, including for the Washington Post, the Wall Street Journal, and the Boston Globe, and she's appeared in several media outlets, including the NewsHour with Jim Lehrer, National Public Radio, the BBC, Canadian Public Radio, and NBC News, just to name a few. In addition to conducting lectures all over the world, she's given testimonies to the U.S. House of Representatives. Her many awards include the 2017 Robert Wood Johnson Foundation Pioneer Award, an International Society for Quality of Life Studies Research Fellow Award in 2014, and Distinguished Researcher Award this year. In terms of some personal notes, according to her CV, Dr. Graham was a competitive runner for several years. She enjoys sailing, downhill skiing, water skiing, and she can play the guitar. So please join me in welcoming the 30th Annual Herbert Lourie Memorial Lecturer in Health Policy, Dr. Carol Graham.
Thank you very much, David and Shannon, for the wonderful introduction. The most important thing, though, is I have 3 beautiful children, which I say on my CV, who are now grown up, but they keep me hopping too. But anyway, I feel a little bit intimidated for 2 reasons. One, I come from a school with a wrong orange color match. It's orange and black and not orange and blue. But the minute I got off the airplane, there was orange everywhere. And then on my hotel, the password was orange. So I feel bad. I almost wore an orange dress, but I blew it. And more seriously, I'm certainly not a medical doctor, but I do come from a very medical family. My father was a pediatrician at Johns Hopkins and started the Department of Nutrition and Pediatrics there, but also, more importantly, has an institute, or started an institute for malnourished infants in Peru a very long time ago, when they did things like discover zinc and copper deficiency and other things like that. But I'm still very involved with that group, and it's really become much more of a public health, looking at the sort of poverty-related public health issues. So the long reach of my interest in these issues stems from way, way back. And also some of the research I'll talk about at the end, I've actually done with that group. So I have to say, I'm still, even though I've been at this for about 5 years, I still find myself a little bit surprised that I'm spending so much time working on the US, which I'm not a particular expert in. Most of my career has been tromping around the world to some of the worst slums anywhere, looking at poverty, micro-level coping strategies under bad macro conditions, and more recently, happiness and well-being, but among some of the poorest people in the poorest places in the world. But over time, as I've been coming back to the US for almost a decade, I kept thinking, what is it that makes me more depressed about poverty here than in these very poor places, in people's faces, in people's everything, just what's going on? So I decided finally that it was really time to understand it much better. And related to that was a lot of surprise at why Americans, even poor Americans, didn't seem to care about inequality when we are, by most definitions, probably the most unequal economy in the world. Maybe a little better than South Africa, but that's kind of a tough benchmark to meet. And so I decided, thinking about all this, I thought, well, maybe it is the metrics that us nerdy economists use to measure these things just don't resonate with the average person. How many people on the street, the average Jane or Joe cares about the poverty head count or the Gini coefficient or the Thiel ratio, much less. It just goes over and they don't really tell you a dynamic story about poverty and inequality. They certainly don't tell you about kind of intergroup inequality, the things that really people care about. So I decided, given that we've had historic increases in inequality and pretty, steady poverty levels for several decades, that I would try to tell the story of poverty and inequality in the U.S. from the perspective of the metrics of happiness and well-being, which I've spent a lot of time developing. And I thought maybe the story will resonate more with people, and particularly non-academics, if it comes, if it's a message about unequal hope, unequal happiness, unequal stress, whatever it might be. I didn't know going into it. And so that's what I did. I both did a lot of research and wrote a book about it. And indeed, I found that inequality is an important part of this story, but it's not the only part. And I found that the story was much more complicated than that. And I think this is where Shannon's and my research interests really intersect, which is the importance that I found in terms of different levels of hope and resilience across races and places. And it's a much more complicated story than I thought going into it. So poverty and inequality play a big role, but there's more to it. So let me start with telling you a little bit about the measures that we use. I know nobody really wants to hear about measures, but it's important that you know how we do all these measures. And then talk a little bit about my research, both for the book and then since then. And in particular, I'm going to talk about the latest research I've done on premature mortality and matching those trends with our metrics of hope, stress, anger, happiness. And then the newest research on hope and resilience, trying to understand what determines hope and resilience, why it matters, and why it differs across populations. So I started with a very simple thing, the pursuit of happiness, right? It's in the U.S. Declaration of Independence. It's not about guaranteed outcomes, but about opportunities to seek fulfilling lives. And it's a concept that's grounded in Aristotle and in Mill's sort of conception of liberalism, which combines social fairness with individual effort. So it isn't about, guaranteed anything, but it is about the right for people to seek fulfilling lives. So the basic question I asked in my book, which is called Happiness for All, Unequal Hopes and Lives in Pursuit of the American Dream, published by Princeton last year, is the American dream and the right to the pursuit of happiness still available to all citizens today? Maybe it never was, but I think it was more widely shared than it is now for a number of reasons I'll tell you about. And so my research explores why our increasingly distributions of income, well-being, and hope matter today and in the future, why they're going to matter more in the future. And we have some stark markers already. The very divided 2016 election woke us up to anger and frustration in this country that I think we didn't realize existed. And an even starker marker is the rising premature mortality rates among less than college-educated whites, the deaths of despair that Shannon spoke about and has done wonderful work on. So again, just a little bit on the metrics. So the measurement of well-being, everybody talks about happiness, and it gets public attention. It's actually the least well-defined term in all of this research. It sells books, so I confess it's in the title of all of my books. But from a research perspective, it's not a great term because it's just not well-defined. It could be happiness today. Are you happy today? Could be happiness with your life as a whole, and they're very different concepts. I'll talk a little more about that. So we really have a whole new science of well-being measuring well-being, and it involves collaborations. It started as a very nascent collaboration between economists and psychologists, and at the time I was one of the early people involved in this, and very lucky to be pretty early in my career in working with amazing people like Danny Kahneman and Dick Easterlin and George Akerlof. And Danny Kahneman went on to win the Nobel Prize in Economics as a psychologist, the first psychologist to get a Nobel Prize in Economics. But the point is that these collaborations, which are initially seen to be crazy, economists were like, you're working with psychologists? What's wrong with you? Have really become quite a force. And since then, we now have also geneticists, biological scientists, medical doctors working in this field. So it's become a pretty exciting area to work in, and a really burgeoning area, I think, for understanding a host of public health and other problems. We can answer questions as diverse as the effects of commuting time on well-being, why cigarette taxes make smokers happier. That sounds crazy, but if you think about smoking not as an optimal consumption choice, which is what standard economics would say, but as a self-control problem, then it makes more sense. And why the unemployed are less unhappy with higher local unemployment rates. Again, sounds really weird, right? So economics would say, if you're unemployed, and you have a higher local level unemployment rate, your predicted probability of being reemployed later is lower. Well, most people don't sit around and calculate their predicted probability of being reemployed later. They know they're miserable, they're unemployed. If there are more unemployed people around them, they feel less stigmatized, there are more people to play backgammon with, whatever it might be. So this method in particular is well suited for understanding situations that can't be answered very well by the classic economist revealed preferences approach. So the kind of basic approach in economics and many others, certainly political science, is based on observed revealed preferences. The idea is that you can't believe what people say in surveys. It's nonsense. It's all noise. But you can believe what people do if they make a consumption choice in and they have a fixed budget constraint. But actually, we all know people make really bad consumption choices. They try and keep up with the Joneses. They drive 10 miles to save 10 cents on, paper towels. There are all kinds of people consume badly due to addiction and self-control problems. There are all sorts of things that suggest that consumption decisions are really not much better than survey data. And over time, as we've used more and more survey data, we've found consistent patterns in how people answer these surveys, particularly about their well-being. Indeed, I spent a lot of time before working on well-being just trying to get good data on income and poverty standards for countries around the world. And the gold standard for collecting income data in poor countries is to use expenditure surveys, where you're asking people how much they spent in the last month. Data that's incredibly noisy. I mean, how can people who don't have a paycheck tell you what they earned in the last month? Another issue is, there's really no incentive to lie to a survey about your well-being. But if you're in a country with a really bad tax system and somebody's coming and asking you about how much you spent or, the last month, you have a big incentive to not say what you spent, right? So in any event, survey data is now increasingly being used by economists. And it's particularly well suited for understanding situations where individuals don't have the agency to make choices, or when consumption decisions are not the result of optimal choices. So I work in two areas. One is the macro and institutional arrangements individuals can't change, like inequality, like stagnant unemployment rates. It's very difficult for any individual to exercise a choice, right, in that sort of arrangement. And a trend Shannon mentioned that I've been looking at and thinking a lot is the percent of prime-age males who have simply dropped out of the labor force. That's not an active choice. That's just, it's no choice. And they're not even in the unemployment rate anymore, because if you haven't actively looked for a job in the past 6 months, you're not even calculated in the unemployment rate. So they've fallen out of our data, right? So standard methods don't capture that kind of situation well. And then also, I work a lot on behaviors that are driven by imposed norms, addiction or self-control problems. Opioids is an obvious example, but also when you think about situations where people don't have the agency to make a choice, I often use the example of someone from a lower caste in India who doesn't send their child to school. Now, is that a choice, or is that a result of very strongly imposed norms that say, you're in a lower caste, you'll always be in a lower caste, your kid's going to be in a lower caste, the school is dirty and dangerous and expensive? So I don't know. I mean, you can think of it as you like, but I wouldn't call that a sort of revealed preference to not send your child to school. But we can measure the well-being effects of that choice or lack thereof with these metrics. So Let me say a little bit about terminology. I already talked about happiness not being a very well-defined term. There's a chapter, not in this book, but the one before, called Should We Have Bentham or Aristotle in the Statistics Office? The answer is we should have both. But we measure two distinctions of well-being, and they tell us very different things about people's lives. So hedonic well-being measures how people experience their daily lives, their mood, positive or negative, smiling or worried yesterday, as they do different things like commuting, spending time with friends, or working. And that's what I call the Benthamite kind of well-being. Bentham defined happiness as the most contentment for the greatest number of individuals. It was a very hedonic concept of happiness. So that's what we call hedonic or experience well-being. Then we also measure what we call evaluative well-being, and that correlates much, it's usually based on life satisfaction questions. How satisfied are you with your life as a whole? And it correlates much more closely with income than general happiness, or certainly with hedonic well-being, because respondents are evaluating their life circumstances as a whole. So if you're young, you tend to think about what will my life be like as you answer these questions. Your life in general, I mean, that's a big question. And if you are old, you usually look back on what have you achieved? Have you been able to lead a life that you wanted to lead? Did you have choices in life? And so not surprisingly, answers to these evaluative life satisfaction questions are more closely linked to income than to just hedonic well-being. It doesn't mean that more and more money leads to higher and higher scores, but certainly people with means answer higher on these questions, in the score on these questions than do poorer people, because people with means have choices, right? They have the ability to choose to be an artist or a professor or a banker, right? And then I won't linger about this, but we have started to measure the really Aristotelian definition of happiness in eudaimonic metrics, and we're measuring, do people have purpose or meaning and fulfillment in their lives? Explicitly, that's a new area, but the life satisfaction question sort of picks up that dimension of life, not explicitly, but it tends to. Okay. So Shannon was worried about equations. I promise you this is the only equation I'm showing. It's a very simple one. And if you want to just ignore everything else I say on this slide, the point here is we're not running around asking people, does unemployment make you unhappy? Or does, eating ice cream make you happy? Whatever it might be. What we do is we have these huge sample sizes of literally millions of people around the world, in the Gallup data anyway, but a lot of large-scale surveys. And we take the reported well-being of individual I at time t, which is when they answer the survey, and those questions need to be high up in the survey, so you don't want to ask somebody about their life satisfaction after 4 questions about are they satisfied with their job or how's their marriage or whatever, because that's going to bias it, right? So you have this reported, and they don't know that we're linking that response to all the other things that we ask about them. So their demographic traits, their age, their gender, their race, where they live, urban, rural, whatever, and their socioeconomic traits, education, employment, occupation, whole range of stuff. And so this is well-being of individual I at time t, and that BXIT is that whole vector of all those things. And then epsilon, the error term, is actually an important part of all this, because most standard econometrics work, you just treat that error term as noise. That's just noise in the data that you didn't observe or couldn't explain. But if you think about the fact that about 90% of individual well-being is not explained by all these other fancy things. If they're just innate character traits and other things we can't observe, that error term carries a lot of information about people's innate levels of well-being, their character traits. And I can't really get into this now because it's not the subject for today, but we've used that data to be able to show how innate character traits and unexplained well-being actually correlates with future outcomes, and that individuals who have more innate well-being tend to do better, be healthier, live longer, all kinds of things. And that people on different points in the distribution of well-being over people is bell-shaped. just like most normal distributions. And so we have the average, people in the average are in the bell, but they're the happiest people and the least happy people, and they're quite different. So the happiest people care least about money. They love learning and creativity. They don't really care if they're employed full-time or not. The least happy people care most about money. They're not at all resilient to negative shocks. And so there are different traits on these extremes of the distribution. But for the average, so going back to the average, what we find around the world, and this is including very, very poor countries, countries of different cultures all over the world, we find incredibly consistent patterns in the determinants of life satisfaction. Income matters, as I mentioned. It's not the only thing. It's not more and more and more income, but income actually matters to people's well-being. Being destitute is terrible for lots of things, but it's not even good for your moods, right? Age matters. I'll tell you more about that in a second. Health is more important than income in relative terms, to the extent we can put relative magnitudes or relative weights on these coefficients in our equations. And we also know that just through empirical work, through anecdotal stories. Employment matters a lot, social relationships, and marriage. So this is a funny way to talk about marriage, but a lot of the surveys find that married people are happier than not married people, right? So there's a lot of, particularly conservative press has picked up of this and said, see, it's good, marriage makes you happy. Well, it turns out marriage is simply an artifact of construction in the data, the finding, because what we're doing is we have what we call cross-section data, one observation at one point in time, a lot of people, and we're finding that married people are happier than people who didn't marry, right? Well, it turns out happier people are more likely to marry each other. So the causality could run in the other direction, and likely does, and then the people that didn't marry are slightly less happy, and that's what you find. The few overtime findings we have about marriage suggest that the overtime sort of marriage boost in happiness lasts a big 18 months. Hate to disappoint you. And I have a wonderful colleague in France, Claudia Senek, who wrote a paper called You Can't Be Happier Than Your Wife. And it turns out she did have overtime data for a long, big data set for Germans that runs over about 20 years. And that she found that the probability of divorce was highest when you had asymmetries in happiness levels. So it's much better to have two happy people married to each other or two unhappy people married to each other. But if you have a happy person and a miserable person married to each other, they drive each other crazy. I can attest to that. I was not the unhappy person in our marriage, but it was really awful. Anyway, so you have to be really careful about inferring causality when you just have one observation for people in at one point in time. But because these things are so consistent around the world, we can then control for those, right? We include those in our equations, but then we can explore the happiness effects of things that vary or change more, such as inflation and unemployment rates, inequality, something we're talking about today, environmental quality, personal behaviors such as smoking, exercising, commuting time, and much more. Again, the most important thing to remember, you can forget the equation, is that we're not asking people if any of these things make them unhappy or happy. We just know how much they smoke or how many hours they commute and all these other things in the data. We control for all these things, and then we can see variance across people who smoke more or less, commute more or less, run more or less. So a last thing that's a little bit about the methods, but also very much leads into the premature mortality stuff. So this is a remarkably consistent finding. It holds around the world. It'll make you unhappy or happy depending where you are on this curve. But there is a U-shaped relationship between happiness and age. This is controlling for age-adjusted health. So we don't expect a 75-year-old to have the same health as a 45-year-old or a 25-year-old. It's age-adjusted, and income, a couple of other things. So we're looking at the pure effects of aging, basically. And what we find, this data happens to be for Latin America. I'm from Peru. The low point in Latin America is about 47, so I'm fine. I'm happy. I'm going up. For the US and Europe, it's about 44. We find this holds for 100, out of 162 countries in the Gallup poll, this holds for about 130 of them. Where it doesn't hold is countries where it's terrible to age, where pension systems are awful, where it's awful to be sick when you're old. Think about the Democratic Republic of Congo or something like that, or even the Eastern European countries. Some of the Eastern European countries, particularly Russia. So, and the turn is usually in the middle age years. In really happy countries like Costa Rica and Denmark, it turns earlier, so people get out of the U, and because they have more happy life years, there's sort of no justice, but they do better over their life course. In places where it's terrible to age, like Russia, the turning point is about 60, which is life expectancy for males. So you can draw your own conclusions about what's going on with the women as they go up the curve after the men die. And then this also holds across people. So remember I talked about the happiest people and the least happy people on this bell curve distribution. So the happiest people also turn older. They also live longer. And they have more happy life years. Now, this isn't just about happiness. There's something biological going on. We also find in the same set of countries, almost precisely the same countries, stress has an inverse U turning in the same age range. So there's something about these middle age years. It's not that surprising. There are a couple of things going on. There's an aspirations aligning with realities effect. By the time you're 47, if you can't sing and you don't play guitar, you probably shouldn't try and be a rock star. And that can be hard, but then you get it. There's also often the double financial burdens of teenage kids, college kids, older aging parents, whatever, that can tend to sort of crunch up in these years. Psychologists also have sort of related explanations, but they talk about emotional wisdom increasing as people age. Right? So people, as they age, get more appreciative of life. They have less emotional swings. So in economic terms, I think about this as the standard deviation of bad experiences is much higher when you're younger, right? Because you've had less bad experiences. I've had 3 teenagers at the same time. They're getting out of it, but my youngest are 19. But and I always, one bad experience is the end of the world because it's the end of the world. But when when you get up here, you've had so many bad experiences, they just roll off your back. They just bother you less, right? So a last point on this about there being more to it than just, happiness in the data is that there is something biological going on. So my colleague Andrew Oswald in England wrote a paper about well-being in chimpanzees, I kid you not, and he found that their cheerfulness, they have measures of cheerfulness, declined at the midpoint of their life years. And it was published in Science, so it's a pretty good study. He and a bunch of other people that work with apes and everything else did. So this U-curve is incredibly lasting and sort of crosses countries, cultures, people. And it also shows how this research pulls together kind of biological research, psychological research, economics research. But to the point of today, when you look at the US today and what Shannon works on and what I've been working on, these deaths of despair, a significant proportion of Americans are not making it out of this U. They're primarily less than college educated whites, primarily, but not only in the heartland, it's actually spread a lot. And it turns out it has a lot to do with lack of hope and a lot of stress and a lot of desperation, all the things that make people very unhappy. So to the point, more to the point of today, if you think about this kind of daily experience versus life fulfillment part of happiness, it turns out that people with more positive attitudes about their future, and that sort of believe in the future are happier and vice versa. And this tends to be linked with more willingness to invest in the future and in better future outcomes in the health, income, and social behavior arenas. This is sort of where you get a two-way causality between not just better health and more income and more well-being and happiness, but more well-being and happiness seems to result in better outcomes. But there are many people that have much more limited future opportunities and lower levels of well-being, and they have higher discount rates, which in economic terms means they are much more likely to trade off the future for the present. Because if you don't believe in your future, you have limited ability to invest in it, you're much less likely to. And so they tend to focus on daily experiences as they lack the capacity to plan ahead. Life is very stressful. It's driven by circumstances beyond individuals' control. It's something I call bad stress, and we show in the data that if you have a lot of stress and you don't have much income or education, it's actually much, much worse for your well-being. There's some wonderful work by Sendil Mullainathan and Eldar Shafir in a book called Scarcity. And it's based on very poor countries, but if you think of the kinds of lives that poor people in the US lead, they're not that different. And it's their lives are so full of negative shocks they can't control that they actually has cognitive effects, and they can't plan ahead going forward. They lose the capacity to plan. So they may enjoy daily experiences. They may say they're happy today. You know, I'm alive, I've got my friends, whatever. But they score much lower on life fulfillment questions, and they just have a much harder time for all kinds of reasons investing in their future. People with capabilities and opportunities are more likely to focus on the longer-term dimensions of their lives, and it turns out that the stress they experience, which is mitigated by income, education, and hope for the future, is much less bad for their well-being. So, America. I think there are 2 Americas, maybe 3, maybe 4, but let's start with 2. And one of the things I asked early on was, does this U.S. exceptionalism, strong beliefs in the American dream, lack of concern about inequality, does it still exist today? So as late as 2001, Americans really didn't seem to care about inequality. I've looked at this in lots of different ways, including the percent of people that supported the Bush II tax cuts, all kinds of other things. But there's a great study on inequality and happiness comparing the US and Europe by Alberto Alesina and some other colleagues of mine, in which they found that in Europe the findings were sort of what you would expect. So inequality had modest negative effects on reported happiness, and they were strongest for the poor. Makes sense. If you have more inequality, you're at the bottom, and it's going to bug you more. In the US, as late as 2001, the only group in the US that was made unhappy by inequality were left-leaning rich people. Probably most of them were either in California or the Northeast, but I can't confirm that. Today, 2016, 62% of Americans thought their children would be worse off than they are. And this has now since been confirmed in other surveys. Basically, the directions of the findings are the same. And about 33% think their children will be better off than they are. And that compares to countries in the OECD like Spain and Portugal, but not all countries. And in Latin America, only 13% of Chileans, for example, think their children will be worse off than they are. This is pretty stark for the, Horatio Alger, everybody who works hard can get ahead society. A much more anecdotal way to get a picture of this came from a study by David Leonhardt in the New York Times based on words in social media. And it turned out that depending if you live in an easy place to live in America, think Northwest Washington, Seattle, Portland, or a bad place, think Detroit, bad parts of St. Louis, Duluth. The words that people use, the common words that people have, are very different. So the common words in poor America are guns, religion, hell, antichrist, stress, obesity, diabetes, video games, and fad diets. Living at the moment, not a really nice picture of things, right? And it's very much, a lot of stress, a lot of momentary things, and then sort of patched together solutions. The common words in rich America are iPads, cameras, baby joggers, baby Bjorns, foam rollers, cameras, and exotic travel destinations like Machu Picchu. So investing in your health and knowledge, investing in your children's health and knowledge, broadening your horizons. It could be 2 Americas. So let me show you some of my data that really paints this picture. So we have data I'm involved in this data collection from the Gallup Healthways surveys, which surveys from 2008 on 1,000 Americans a day, nationally representative sample. So it's a huge coverage. of millions of Americans. And then the Gallup World Poll, which I mentioned, which is approximately 1,000 people per country per year in 162 countries. And what I'm going to go through quickly is comparing kind of well-being and attitudes about the future in the US and Latin America, a region long known for exceptionally high rates of inequality, although there have been improvements in the past decade. And then within the US, explore how trends and well-being and ill-being vary across racial and socioeconomic cohorts. And then we've matched those trends with the CDC data on premature mortality due to deaths of despair. And then lastly, just give you a snapshot of some of our newest work on hope and resilience. So these are just snapshots, but I think they're pretty telling. So this is, did you experience stress frequently yesterday? Yes or no? Very simple question, very little error in that question. There's no framing effects. And as you can see, Latin Americans on average experience much less stress on a daily basis than do respondents in the US. But the bigger story is the difference. So here the poor experience more stress than the rich in Latin America, but the difference isn't that big. The difference between the poor and the rich in the US is almost twice as big. So not only do the poor in the US experience much more stress than the poor in Latin America, but much more stress than the rich. This is smiling yesterday. I love this graph because Latin America is a pretty great place to live. And as you can see, Latin Americans smile more on a daily basis than the US. Again, the big story is the differences between the poor and the rich. Twice as big between the rich and the poor in the US than the rich and the poor in Latin America. I mean, Latin America is a really poor place compared to the US. So this is pretty striking. And then this is the question, ooh, that's not what you want. This is the question that, or the results that really made me think I should write this book. And this is a question, if an individual in this country works hard, he or she can get ahead, yes or no? It's a classic American dream question, pretty hard to get it wrong. You either believe yes or no. And if it turns out here that Latin Americans, whether they're poor or they're rich, answer the question the same way. In the US, the rich are 20 times more likely than the poor to say hard work will get you ahead. So that I thought was striking. So what I did is, at this point I started thinking about, well, how does this vary across races, poor people of different races in the US? When I went into this is before the deaths of despair data came out, and I compared poor blacks, poor whites, and poor Hispanics. Those are the three biggest groups. It was a time of the Ferguson riots, the Baltimore riots, a lot of concern about the African American community in the US. Ignore that equation. In fact, I thought I'd taken it out. But what we look at here is basically the reported well-being for individual I in MS. We're looking at metropolitan statistical areas. And we look at life satisfaction today, expected life satisfaction in 5 years, which is pure optimism question. Then we looked at stress, worry, anger, city satisfaction, all kinds of other stuff. And we controlled for a lot of things, and I'm not trying to walk you through a lot of econometrics, but it's important because these things could be competing explanations, and we've controlled for them. So these include age, BMI, so overweight, obese, gender, education, employment status, experiencing pain the previous day. People who experience pain the previous day are much more likely to be on opioids. So I didn't want that to be, what's driving this. Marital status, religious preference. Again, I wanted to make sure my findings aren't driven by religion. And then destitution, lack of food for money and healthcare. And then after we added in this CDC composite death measure, which includes suicide, liver disease, accidental poisoning, and indeterminate deaths. So what did we find? So I was sitting in my office. This is well before the deaths of despair data was going on. It was sort of right after all the riots in Baltimore and Ferguson. And what I found, this is a question on optimism, that life satisfaction in 5 years question. The left out group here is poor whites. So their response is a 1. Poor blacks, these are all poor groups. Poor blacks were almost 3 times more likely to be optimistic about the future than poor whites. And poor Hispanics about 1.25 times. That didn't surprise me, but this certainly surprised me. Indeed, at first I thought I had a coding error. I went back and reran this because it just, And then the same goes for stress, which sort of confirmed there's something more going on here. So poor blacks are half as likely to report stress the previous day than poor whites. Hispanics a little more, but again, much less. So there's something, more fundamental going on here. And we know that poor blacks don't experience objectively less stress every day than poor whites. I mean, there's everything else would suggest otherwise. They're more objectively deprived. So what was going on? I did a lot of work talking to sociologists that worked on African American culture, history, all sorts of stuff. Lots of hints of differential levels of resilience and other things, but I still didn't really have sort of a full story. And then this came out. So these are the deaths of despair. This is the same mortality rate that I use for the next set of results, which is this preventable deaths due to opioid, suicide, other things. And if you look here, and this particular chart is 45 to 54, that band of deaths of despair is now more like 35 to 65 as the death rate has increased. But this is from Case and Deaton, their first kind of findings of these. So these are US whites, France, Germany. The green line is US Hispanics. They don't have African Americans on here, but they have a slightly higher level of higher mortality than Hispanics, but their trend, like Hispanics, has been going down. And every other country, France, Germany, UK, Canada, Austria, Sweden, of comparable income levels, you see mortality rates going down, except for US whites. So obviously I asked myself, is there a link between this and this, right? Is lack of hope. I mean, if people are killing themselves prematurely, is it desperation? Is it lack of hope? Is it stress? Do these things matter? And if so, it's a lot easier. It's very easy for us to collect these metrics. If we'd been doing this earlier, maybe, and we knew there was a strong link, we might have picked up on ill-being in a particular cohort well before we got to the point that there's a crisis that we really have a hard time reversing. So what I did, and I'm sparing you all the equations from now on, I promise, no more equations. We looked at the individual level and then also at average MSA level to sort of see if our metrics of well-being and ill-being matched robustly with the deaths of despair. And what we found at the individual level was that this MSA composite death rate for 35 to 64-year-olds, now this bigger band, is negatively correlated with life satisfaction and with optimism, and positively correlated with stress and worry. And this could go two ways, right? If you have no hope, you're stressed and worried, you're more likely to fall, and the reasons behind that lack of hope, stress, and worry, you're much more likely to fall into the deaths of despair category. But if you live in a place where there are lots of deaths of despair around you, I mean, you can imagine if you're kind of in bad sorts, it would make you more likely to be on opioids or to kill yourself, whatever it might be. I don't know. All I know is that it matches very robustly with the well-being trends. And then we also looked at the role of place and health behaviors at the aggregate level, at the MSA level. We found that the percent of smokers per MSA is negatively correlated with life satisfaction and positively correlated with stress, which in turn are correlated with deaths of despair. The percent of respondents who exercise is positively correlated with current and future life satisfaction and negatively correlated with stress. So you start to get a picture of places that are more stressed, that have worse health behaviors. And racial diversity is a characteristic of place. So the share of blacks is positively correlated with life satisfaction, optimism, and negatively correlated with stress. At that point, we're just averaging it up. If you have more blacks and they're more optimistic and less stress, it's going to show up. But basically, minorities, more minorities. And then all you need to do is look at a map. And Shannon has produced plenty of very good maps about the kind of geographic distribution of the opioid crisis, and the coasts and some of the east and west, and even some in the south, that are more racially diverse, more urban, more economically vibrant, have less deaths of despair, and the middle of the country, suburban and rural places that are much more homogeneously blue-collar white, have very, very high levels of deaths of despair. And in the questions, I'm happy to go into more about what we know about these places, what we know about what we call comeback cities, places that have managed to turn around. There's some good stories there. Right now I'm focusing a lot on the kind of bad story, but it's with us and we have to deal with it. The last thing about place, which is something I can't say I've done anything other than try and get a sense of this, because it's very hard to do robust work on place. It's kind of there are all kinds of things that go into place, right? But if you just look at this lower slide, we compared where whites were more optimistic and where minorities were more optimistic around the states, at the state level. And the dark green bars are where minorities are the most optimistic in the country. And this is controlling for education, employment rates, religious preference, a whole bunch of things that you think might explain this. So this is simply kind of what we can't observe about place that's different and linked to optimism. Well, if you look at this is a southern cluster of states, Louisiana, Mississippi, Arkansas. These are objectively deprived places with horrible health indicators and lots of other things. But there's a concentration of African American culture and music and all kinds of other things in these places. And these are very heavily Hispanic populated places. So there's something about whether it's shared cultural norms, whether it's just more diversity, that make minorities significantly more optimistic, even in places that are where they're more objectively deprived. So this is something we don't fully know about, but you can look at the same story for blue-collar whites, and we get this kind of lack of hope, stress, all concentrated in places that are homogeneously white. So just a quick snapshot. Let me see how I'm doing on time, and probably not very well. So we've been trying to understand these differences in resilience across races and places, and I have 3 sets of work going on, and I'll just toss out some snapshots of findings and then stop for questions. But one is just looking back historically at the panel study of income dynamics for the U.S., which has followed people born in the U.S. from 1935 to 45 until now. It's nationally representative. And we found there was an optimism question in there. And the question is basically whether you or not you think life will work out on a scale. Sort of, are you confident life will work out or not? And what we find is that for respondents who were born between 1935 and 1945 and who reported to be optimistic in their 20s, so interviewed again in like the 50s and 60s, that they're much more likely to still be alive in 2015 versus the non-optimists. We found 2 other things that again suggest if we'd been following these metrics over time, we might have been quicker to pick up on the deaths of despair or the roots of the deaths of despair. We find that women and blacks increased their optimism in the 70s. They started out as less optimistic than white males, and they became more optimistic from the 70s on. And that low-skilled whites began their decline in optimism as early as the 1970s, about the same time that manufacturing declined. So again, it's just saying we should have picked up on this earlier, but we didn't follow well-being, so we didn't know. Then we have a study in Peru on hope and differential levels of resilience, where we find incredibly high education aspirations among poor young adults. And I will show you a couple of results on that slide. And then just something we've been testing, because I think if we're going to talk about optimism and hope being a good thing, we want to know 2 things. Is that people just mispredicting and they're optimistic and their lives actually aren't better and they're just kind of Pollyannas or naturally happy? And how long does hope and optimism last as a channel? If you're optimistic but you keep getting negative shocks, are you resilient? Do you retain that? How long does that last? I can't fully answer the last question yet, but we did test in a new panel from Gallup from 2010 to 2014, and now we've updated it a little bit. Optimists in the period 1 don't predict their future life satisfaction perfectly. It's hard to do. If you've been asked, on what point in the scale do you think you'll be in 5 years? It's hard to, but the trend is very consistent. People who report to be optimistic about the future in the first period are still very optimistic about the future 4 or 5 years later. And they do actually do better. We find that on average they had more income gains over that period. And these aren't particularly wealthy respondents, it's everybody. And blacks remain the most optimistic group over time. And we've even now looked at the post-Trump election data for 2017, and there's a very, very modest decline in black optimism, and the gap between poor blacks and everybody else still remains very large. So this is consistent. It's not just driven by news and other things. This is just, that's the mortality stuff. I'm going to skip it. So the study in Peru, it's on 400 18 and 19-year-old adolescents in a poor or semi-poor urban area. So part of it has water and electricity, part doesn't. There's access to a metro if you walk. This used to be really, really poor. So it's kind of growing from poor and near poor with some almost middle-class people. We ask all kinds of things about household demographics, expectations, happiness, education, marital stuff, risky behavior, risky sexual behavior, drug behavior, all this stuff in a confidential part of the survey. Time preferences, are you willing to give up income today to save income for tomorrow, a whole bunch of stuff. And it's really important to note that not one of these kids has a parent who's gone to college. The parents are all construction workers, taxi drivers, domestic servants, trash collectors, whatever it might be. And when we ask them what level of education would you like to complete, 85% of these kids say they're going to college or postgraduate education. And when we follow up and say, do you think you can achieve that, 95 out of the 85% say yes. And we looked at data that show that these education aspirations actually match, not perfectly, but pretty closely with patterns in education outcomes. So having high education aspirations, being, optimistic about your education in the future, you're more likely to complete more education. Just ignore the numbers here, but it reminds me what to say. So the other thing we find, 2 other things, this also correlates with a lot of these innate character traits I talked about. So happier kids are more likely to have high aspirations. Believing in hard work is linked to higher education aspirations. This impatient variable is this discount rate thing. If you're much less likely to have high aspirations if you won't give up, money today for the future. You have a high discount rate. And then also internal locus of control. If you believe your life is in your control, again, more likely to have higher education aspirations. The other thing is almost all of the kids in the high aspirations group has had 1 or more negative shocks. They've been a victim of thievery. They have a sick person in the household. A parent has walked out and left the household. So they're very resilient to negative shocks. They're only not resilient if they're sick themselves, which makes sense, because then how can you, if you don't have agency, you can't have high aspirations about what you're going to do. And what I want to do with this survey, I'm planning to, I'm raising money for it, is to repeat it I've been doing a lot of work with WashU and St. Louis, where you have problems concentrated in a very small radius. So you have the worst African-American blight I've ever seen. In the poor part of St. Louis City, across the river, you have former coal mining towns, high opioids. And already it looked and found that, amazingly enough, poor blacks in St. Louis City are still incredibly more optimistic, not only than the white, but then the rich people across Del Mar Boulevard in St. Louis. So my guess is that if I ask this question, what level of education would you like to complete? I don't know. I mean, I think I'd get a lot about negative shocks, but my guess is that in sort of desperate opioid, poor white parts of Missouri, people are already very skeptical of college and elitism and everything else. And I won't get 85% of adolescents saying they're going to college or postgrad. I don't know what'll happen in St. Louis City, but my guess is I'd still probably get higher hopes for the future. Okay, so let me end quickly. I've talked about this, the 2 Americas, basically this whole body of work showing that people who believe in their future, who are hopeful, whether it's because of intrinsic motivation or their capacity to have longer time horizons, do better. And we have every sign that There are big gaps in the US between the poor and the rich on these markers. But then there's also this twist in terms of differences across races. Why aren't blacks and Hispanics in the deaths of despair? Why are they more resilient? Why are they more hopeful? I mean, I have some thoughts, and I can talk more about that in the questions. Obviously a big part of the story is the decline of the white working class, structural trends in the world economy, tech-driven growth, more competition for low-skilled jobs. And this group saw this in the 70s. That's what we find, right? In the US, I mean, this occurs in Europe too, but in the US, I think it's exacerbated by particularly high inequality, by weak public education, and also by welfare that stigmatizes recipients, right? If you're on welfare, you're a loser. We don't have a comprehensive, public welfare system. And particularly for this group that had the stable job and the stable nuclear family, when both of those things fell apart, they didn't have a narrative. They didn't have the extended social ties and social capital and Baptist churches and Hispanic families that minorities did. And minorities had less expectations about the American dream to begin with because they had faced discrimination and they didn't have privileged access to blue-collar jobs. So they had a whole other set of narratives in their lives. But for the working blue-collar men in particular in these places, they sort of lost the narrative of their lives. And this is where you see the biggest percent of males dropping out of, prime-age males dropping out of the labor force, opioids, premature deaths. And all these things are obviously linked, although we can't say perfectly how. And then, I don't think I fully understand these differential levels of resilience, although there's obviously some explanation. We see it in lower suicide rates, but we also see it in the willingness of minority men to take other jobs. There are lots of jobs available in the health sector. White women will do them, black men and women will do them, Hispanic men and women will do it, but white males, for the most part, won't. That's what the data shows. And then 2 last points. Hope matters, right? We're finding that people with hope do better. We don't know how long that channel lasts. It seems to be pretty robust, but I want to understand that better. We know that blacks and Hispanics have much more of it than whites, for at least at the low income level. We also don't know if can hope and resilience be learned? Is that something that we could do something about, or is this just the way it is? I hope it's the former, but I don't know. And then this last point, it's so cheap to do. The UK has well-being metrics in their official national survey every year. It's 4 questions. It costs almost nothing to include, and yet we could have been regularly tracking this over time, and we might have woken up to, it wouldn't have been just me in my office working with Gallup data going, what is going on with poor whites? I have a coding error. I mean, it would have been in our national data. It would have started a conversation a lot sooner. So that's it. Obviously, lots of unanswered questions. I'm happy to try and answer whatever I can. Oh, just quickly, I'm very happy to see my dear friend and former Brookings colleague, Steve Bennett here, who's now Vice President for Academic Affairs here. You're very lucky to have him. He is a dynamo. So good catch, you guys.
Thank you. That was really excellent. Of course, I agree with everything that you said. So we have about 25 minutes for questions now, and we have folks from CPR walking around with microphones.
Hello. I don't think it works. Is on? Okay. Thank you so much. My question is about measuring happiness. So I've read behavioral scientists been very worried about asking happiness questions as a part of large surveys. And the nature of the worry is that if I change questions at least slightly, I'm going to get different results. For example, if you ask me, do I get enough sleep? And then if you ask me, am I happy? I'm going to say, no, probably I'm not happy because of that. But if you reverse the order, I'm going to provide you with different answers. So since you're invested in collecting data about happiness and working with happiness data across countries and surveys, do you think that is something that we should be worried about?
Well, that's the easy. There are much more difficult problems than that one. That's the easy problem. We know, put the questions up front. Because if you frame an open-ended life satisfaction question with a question, as I said, about your marriage or your job or whatever it might be, or your sleep, It's going to affect how one person answers, or it'll affect your whole survey if you put it in the wrong order in the survey. But we know their best practices for measurement now, and that's like number one. We know their day of the week effects. You can't ask half your survey a question about life satisfaction on Sunday, which is happiest day of the week, and Monday, which is the least happy day of the week, and think the results will be the same, right? So we know that those are simple questions about data collection. The tougher questions are things like adaptation. When you have poor people who adapt to terrible conditions and are naturally cheerful, and they say, yeah, they're happy today. We find that when we measure these different dimensions of well-being and we look at life course answers versus just contentment answers, that poor people will score lower on the life course answers because they're being realistic about what they can do with their lives, but they may adapt and say, I'm happy today, kind of thing. There are lots of questions about are the scales comparable? Do people change their scale over time? That are a little more complicated. With the large numbers we have, we usually can deal with a error that could come from one person's answer. The other thing, one criticism is, there's a debate about whether why happiness doesn't seem to increase with income after a certain amount of income across countries in particular. And there's a lot of people say, it's because the happiness scales are top-coded at 10, and income is continuous and goes all the way up the scale. So how are you going to increase happiness on a scale that stops at 10 when income increases more and more? But if you look at the distribution in these surveys, there's never a bunch of people bucking up against the 10. As I mentioned, the distribution is bell-shaped. So it's not like you're getting more and more people in the 9s and 10s in richer countries. It's just not happening. So you could scale it 1 to 20, and I think you'd still get a pretty bell-shaped distribution. So it's a good question, and how robust are these surveys? As I mentioned, income data's got a lot of problems and a lot of quirks. So does this data. I think we're pretty good at picking up on some of the main problems and being able to correct for it. I mean, the OECD's issued best practices for statistical offices around the world if they want to collect these data on, for example, question ordering, question framing. I mean, I could go on forever, and you don't want to know it all. But so, I mean, we're definitely aware of the potential problems. Steve? Oh, I guess Shannon's moderating, but I just don't.
I'm not really a moderator when the microphone control is over.
Carol, a terrific speech. I've seen your presentation many times, and I learned something every single time. And I'd like to pause on something I learned today, which is the incredible educational aspirations of that cohort of Peruvian youth. And the question I have is, what was happening in Peru at that time? Were they seriously investing in secondary and tertiary education? Was there a policy reason why Peruvian youth were feeling upwardly aspirational in their education hopes and dreams? And that would be suggestive of something we could do here in the States.
Well, that's a great question. And I've asked lots of people about it. First of all, these are urban adolescents, so I'm not sure you'd get the same results in very poor parts of the Sierra, although they've been reducing poverty and increasing infrastructure and communications and schools. So Peru has traditionally invested a lot in education. It's not always the highest quality, but basically public education through tertiary education is available if you want it. Now, if you're poor and you go to school and instead of working full-time, you're making a financial sacrifice. It's not necessarily easy to pull off. But the other thing I think that's happening that's quite relevant to what's happening in the blue-collar working class here, very different, is that all of these parents who are taxi drivers and construction workers and informal sector workers, they don't work glamorous jobs, they work very long hours and they commute long hours, but they're making it. They're getting, if you look at what's been happening in terms of poverty reduction, it's been reduced. If you look at the expansion of what you would consider middle class for Peruvian standards, it's increased. And they want their kids to do better. They don't want their kids to be taxi drivers and construction workers. So there's a very strong cultural focus on education. And I think that's probably holds for much, but not all of Latin America. Related to that, and I think this is something that really upsets me about the state of discourse and the state of our social welfare system in the States. In Peru, like many Latin American countries, they have very successful conditional cash transfer programs. So if you are below the poverty line, you get a non-marginal amount of cash. It isn't just peanuts thrown at you. It's, it's significant for a family of 4. Conditional on your sending your children to school, taking them to the health post, and taking yourself to the health post. What is the message that's sent? We will invest in you if you invest in being a productive member of society and educating your child and investing in your health. And these programs have, they're not perfect, but they've been shown to be really effective, not just at poverty reduction, but in increasing hope and all kinds of other things. And when you compare that to a social welfare system that stigmatizes the poor. So I've looked a little bit at the bureaucracies that administer our benefits. So the universal programs, Medicare and Social Security, have these almost seamless bureaucracies. They're semi-privatized. They work, you get your check in the mail, there's no stigma, very efficient. Medicare, Social Security, even earned income tax credit, because that's a program everybody loves. So if you're on earned income tax credit, you get, once a year, you get a big boost. You get like a reverse tax thing, and you get a check that's substantial. It's not peanuts, it's not food stamps. And the data show, Bell Salhill's work shows, that people actually, when they get that credit, they use it for saving. They see it as a substantial boost and something they should use to save for the future, invest for the future, and they use it wisely. The programs that administer the, cash assistance for the needy, food stamps, all these other things, are awful bureaucracies that stigmatize the recipients. They vary tremendously across states, right? And they're constantly in political discussions about being cut and, let's make whatever, what's the latest thing? I think it's making Medicaid recipients work if they're not working. So if they're not working because they can't work, you take away their benefits. It's just all kind of negative verbiage around people who fall behind in our society. And if you look at what's happened, again, not all Latin American countries, but the ones that are doing well, the way social assistance is done, the way it's done in many other countries around the world, it's about trying to improve society as a collective, and sort of we'll support you if you invest in yourself and your kids. And that's made a big difference. It's a huge difference in poverty reduction, but I think beyond that. And with the deaths of despair, one of the things that, in addition, is there's kind of this kind of negative spiral. So one way, if you're out of, and Shannon probably knows more about this than I am, but if you lose your job, for a lot of people, the most worrisome thing is losing health insurance for themselves and their family, and particularly if they have like a sick kid. Guess what way you can stay on some sort of health insurance? You go on disability. So disability rolls have increased, but if you're on disability, you're not allowed to look for work. And I'm not saying that is the reason we have so many prime-age males out of the labor force, but it's kind of reinforcing this negative vicious circle. So I feel like in these poor countries that have been reducing poverty, increasing education, increasing the middle class, social policy has been a reinforcing positive force. And in this country, we just seem to be doing everything, in the reverse way.
Hi. Can you go back to your slide that you were comparing Latin America and the U.S.?
Which one? Stress, smiling, hard work?
Stress.
Okay, there is, wait, that's hard work. Sorry, stress, okay.
So when you disaggregate by countries, how does this look? I mean, is the same patterns? Because Latin America is, I don't know how many countries,
It's a lot of
cultures,
countries.
different
Right. What we've done in this is we've controlled for in this aggregate graph for individual country differences. But when you look across countries, I'd say for the majority, it's a pretty similar pattern. You know, I haven't looked closely at, say, Venezuela data. I can't imagine what it would look like, right? But that's sort of a country in complete crisis. But if you compare Chile and Peru and Brazil, you know, I think this pattern's pretty much the same.
Because if you were to go ahead and look at U.S. versus Mexico, I will tell you that people are not smiling when, you know, especially in northwestern Mexico where you have, you know, chronic daily violence. And in reality, it's just, it really does not make sense to look at that. Specifically, if you go country by country, you know, it's like saying, oh, are Africans happier than the U.S.? I'm like, Africa's a whole entire continent. It's the same thing with Latin America, with its different specific, with this
right,
specific
no, we looked, I mean, I don't
violences.
have the results in my head, but we looked at specific countries. Some score a little worse, some score a little better. Again, when you're looking at Mexico as a whole, which is what we're doing this comparison, we're not looking at the nuances between, you know, the high crime regions and non-high crime regions. In the U.S., we're not, you know, we're aggregating out Detroit and Seattle, right? I mean, so it's just an aggregate picture that's pretty robust. I'm sure there are individual country differences, but they don't change the overall pattern. And the within country differences are, you know, even more complicated.
Yeah, in Syracuse, I've found or noticed that there aren't many gas stations in the poorer areas. And that may be because...
Sorry, I couldn't hear you. In Syracuse?
In Syracuse, there aren't many gas stations in the poorer areas. And that may be because there's less cars, or it may be because of something else, I don't know, robberies. I don't really know. But I'm going to take a little bit of a strange direction here, and that is that my pet peeve is that you've got a 4,000-pound car with a 200-pound person in it to get to work to use a gallon of gas. So you've got 20 times the weight of the car. Now here I'm going to efficiency, okay, and activity. And so what I'm saying, what I'm going for here is that where there's activity, you've got endorphins. Where you've got a car, you've got income. But from an environmental standpoint, a lot of things that we do aren't rationalized. The loss, the amount of energy spent moving your body to work, it's 5% efficient at most, because all that weight is moving the car. So I'm just throwing this in like a really different direction in terms of if we really want people to have jobs, and we really want positive results, look at what all of us are doing. We've got 130 million people every day spending gas, 4,000-pound cars, moving 170-pound people. And all that energy moving the car is pretty much a complete waste, other than it gets you to a paycheck.
Right. Well, I mean, it's not. I've looked a little bit at this in terms of why are cities healthier, happier places versus rural areas where everybody drives everywhere, right? So in cities, people walk more, they interact more with each other. That's good for health. It's good for well-being. Maybe not every city, and maybe this is more of a car city, and there are certainly many of them, but in more compact urban areas, more people take the metro, more people take the bus, they walk, and all of that is associated with better health and more happiness, less deaths of despair. In rural areas, particularly, when you have these small isolated towns and you have, you have distance and you have climate and everybody drives everywhere, it's also very isolating. So if you don't have a job to go to, that's, you may use less fuel, but you're also pretty miserable. And there's some evidence from well-being interventions that in places where you have a lot of isolated, particularly elderly people, things like providing new access to the arts or access to volunteering and encouraging, which gets people out and interacting with each other. It has positive well-being effects and often even longevity effects. So it's not really answering your question. Are we inefficient? Is it bad for 200-pound people to drive everywhere? Yes, but and it adds to obesity and all kinds of other health costs.
Thanks for a great talk. I had a life course question, and the Gallup polls and the data that you're using tend to focus on adults and imagining. Do you know if there are studies that are focusing on some of the same kinds of questions but focusing earlier in the life course to try to see how childhood patterns might be translating into some of the things you're looking at in adulthood?
Right. There's some work on children's well-being and then later life course well-being, and they're certainly correlated. They tend to be mitigated by other things like investments in education. The Gallup polls actually interview people around the world as young as 15. So it's actually 15 and up for the world poll. Less is known about consistency in the way kids answer these questions, but there's a bit of work. There's some new work in Britain that I've been modestly associated in from afar on this, looking at well-being over the life course, and some work I've been doing with some PhD students on how does maternal life satisfaction and depression affect children's later term outcomes, and we find that there's clearly a relationship. So maternal depression is associated with lower, for the sort of younger kids, with lower growth in terms of height and weight, and with lower Peabody scores in terms of reading and math scores by about age 5 or 6. This is with a panel data set in Peru. And then we also find that this is more puzzling, and I'm not fully sure it's another PhD student, but she found that she looked at the older kids, at adolescents, and found that maternal depression was associated with riskier behaviors like smoking for adolescents, smoking and unsafe sex. But for some reason, maternal depression mattered to boys more, and maternal life satisfaction mattered to girls. And having had 2 teenage boys, my guess is boys aren't really even noticing if their mother's happy, but they'll probably notice if she's very depressed. I don't know. And girls are more sensitive to their mothers. But in any event, there's some, there's certainly suggestion that children's well-being matters to later life outcomes, and that that maternal well-being in particular matters to children's outcomes. There's also some new work. I've been working a little bit. I live near Annapolis, Maryland, and so when I'm not in DC, I've had some involvement with the Maryland Behavioral Health Association and their work on adolescents, and in particular concern about opioids, children of opioid patients, adolescents on opioids. And one of the things they find that I find terrifying and very depressing, but also something we really need to understand better, is they find children as young as 3 and 4 going to preschool incredibly stressed, children of opioid patients. And and if you think about self-esteem and resilience, they get none of the kind of the things that seem to be the building blocks for both self-esteem and resilience. And so I think we not only have to worry about the opioid crisis today, but about its effects on the next generation. And I think, it's a crisis. I think it's a social crisis of magnitudes we don't fully understand. But if you think about it intergenerationally, it's even more stark.
Time for one more.
Thank you. It's an excellent presentation. Could we go back to the place slide where you had the 2 geographies of the United States? I'm very interested in that data and the correlation with race.
Okay, yeah, and we have I can send you a bigger paper called The Geography of Desperation, and we looked also at stress and anger and all kinds of stuff. But
so I think that's fascinating, looking at the bottom slide, why non-whites, if I understand it correctly, in the dark green
are most optimistic.
And how that correlates with race, and then also maybe how it correlates with do they think their children will be worse off, and what's going on there? And I know you don't necessarily have an answer to it, but I think it's really fascinating the geographic distribution of that.
I do too, particularly when you think about, there's all kinds of work by some of my colleagues at Brookings on how the historical reach of institutionalized racism, and which differs across counties in these southern states, and how it's linked to worse outcomes in terms of crime, social mobility, and everything else today. So here I think, and I'm treading into areas that as an economist I'm probably not good at understanding better, but things like culture, shared culture and norms, resilience, whatever it is. I think a lot about social ties, having seen so much of that in Latin America and also now among the African American community. And the whole, and it's why I controlled for religion, because I didn't want this to be driven by Baptist churches in the southern states. But they do play, they're unobservable positive spillovers of certain religions, right, that probably play a big role. And Ann Case, who's one of the authors of the Deaths of Despair stuff, has been looking a little bit at evangelism and how, which is predominant among sort of blue-collar whites in the heartland, and how, and I'm really out of my league here, but that evangelicals emphasize your individual relationship with God versus, there are other religions like the Baptist Church that are much more about community and much less. And if you think about it, it's almost ironic, because here we've got the same people who believed in the American dream, who don't have it anymore, who don't have social ties and networks to fall back on, who don't believe in government. And then you think even the predominant church is emphasizing the individual again. And I think what's going on in these places is it's like Latin Americans concentrated in the Southwest and African Americans concentrated in the Southeast. And it is about culture and community and music and food. I mean, and it's, again, that's hard to put in robust economic terms. But if you go to Latin America, for the most part, you feel just a whole different sense of quality of life, food and music and everything else that matters to people's lives in ways I don't think we can put a handle on. But I think in places where people have shared disadvantage or negative shocks or all kinds of other things, I think those things play a big role. And the other thing is all about expectations. So there's some wonderful work by Andrew Cherlin at Hopkins, a sociologist who's looked a lot at the identity of the working class. And he finds that minorities are much more likely to report that they live better than their parents did, which for the most part is accurate, right? I mean, it's like the Peruvian kids. They're going to do better than their taxi driver parents. They're going to go to college, and their parents are determined that they do that. But they don't just expect they will do better or that it will be easy. Versus when you have the decline of a whole, cohort of the population, it has really negative effects on all kinds of things. And so blue-collar whites are much more likely to say they live worse than their parents rather than better than their parents. And thinking you live worse than your parents or reporting that you live worse than your parents did is linked with less trust in government, lower levels of well-being, and one other bad thing. I don't remember what it is. It's not good. But so there's also a kind of expectations story.
I mean, at the risk of making a stupid comment, I'll say, in future, asking a question like, do you feel part of community, and how much does that impact your happiness?
Right. No, I think there's been a lot of work on community level well-being. It's not, I've asked questions about how people compare themselves to others in their community and others in their country to get a sense of reference groups. But it's very important. What's interesting about these optimistic poor blacks, though, this isn't a Pollyanna finding. So the same poor blacks who are very optimistic about the future report their financial situation is much worse than do poor whites. They also are less satisfied with the city they live in, right? But they're still optimistic. So it's, there are things going on there I can't fully explain.
Okay, our time is up, so let's thank Dr. Graham.